This is Ringo. He belongs to one of our nurses, Kim, at Vet's Clinic. And he's had a little bit of a problem recently with a condition called hyperthyroidism. So we thought it would be really useful to tell other owners and clients about the condition that occurs mainly in cats, some of the signs that you'd be looking out for, and also what are the options when you find out your cat has this disease. So the first thing that Kim noticed with Ringo, as you can see here, is his appetite was very big. He was always a good eater, but suddenly his appetite had increased. At the same time as this, he'd started to lose weight, and this was a bit of a concern as to why this was going on. The other thing she'd noticed was that his drinking had increased as well, and his activity levels were more than they'd usually been in the past. These raised some alarm bells with us at Vet's Clinic, so we thought the best thing to do would be to take a blood sample from Ringo to check what was going on internally. Now, the only problem with this is that these signs aren't only associated with hyperthyroidism, so we had to give quite a general blood sample first to try and narrow down what was going on. We did find, on taking the blood samples, that Ringo was indeed hyperthyroid, so his thyroid hormones. The thyroid gland is on either side of the windpipe in cats and dogs and in humans as well, and it was overactive, which meant that we needed to give him some treatment for this, and we needed to look at his ongoing treatment for the rest of his life. So the first thing that we did was we started him on some medication. Now, there's lots of options for treating hyperthyroidism. One is taking some tablets, which is every day for the rest of the cat's life, but the levels must be monitored regularly. So he's been coming in for blood samples every 3 months to check that we've got the right level for him. Other options, if your cat won't take tablets, are surgery to remove the thyroid gland. We've also got food, which you can control, but this wasn't useful in Ringo's case because he's one of many cats in a household, and it would have been very difficult to make sure that he was getting the food and not the other cats. And the last option would be some radiation treatment. That's not something that we currently offer at Vet's Clinic, but it is in specialist centres. I'm very pleased to say that now Ringo's been on treatment, he's doing an awful lot better, but we'll need to continue monitoring to make sure that he's well for the rest of his life and make sure that he's not developing any other conditions. But as you can see, he's now a much happier cat.